Hello.
I'm Victoria. I'm a nursing one student at SPC. Was assigned to patient Ronald Jarvis. Do you mind giving me an SBAR report?
Absolutely. Mr. Ronald Jarvis, he's age 619. He's a 16-year-old male. He's 5'11", 171 pounds. He was admitted because he has a stage 2 diabetic ulcer on his right foot and a flare of his type 1 diabetes. He was admitted by Dr. Kate Phillips. He got a wound care consult for the diabetic ulcer. All right. His lungs were clear. His bath sounds were present. He had normal heart sounds with no murmurs. He's alert and oriented times 3. And all other systems checked out normal upon assessment. He's got a history of hypertension, diabetes, and high cholesterol. He doesn't smoke. He drinks a beer a week when he's bowling on Friday night. He's taken Sildenafil, Neurontin, Humalog, as well as HCTZ. All right. He's on no isolation. He has no allergies. He's a medium fall risk. His vital signs were 98.4 temp. Heart rate was 80. His respirations were 18. Pulse ox was 95, and his blood pressure was 145 over 72. Now, about an hour later, it was down to 128 over 70, so it was really getting back to normal. His pain level was 1 into 10, so it's well controlled. He's on an 1,800 calorie diabetic diet, so we're trying to keep it to about 2 grams of sodium, and about 60% of his intake should be carbs.
Okay.
All right. His A1C is 6.5, so he's actually pretty good and compliant with his diabetic treatment. He's got an IV in his right forearm.
Okay.
He has a history of a transurethral resection 5 years ago. He's got some neuropathy. We're rechecking his CBC and his CMP, and we're still waiting for his AST and his urinalysis to come back, okay? He had a low calcium, it was 7.4, so we'll have to watch that, see if the doctor orders to fix that. And his ALT was initially high, it was 38, so it's just a little bit higher than normal. All right, but that's pretty much the gist there. So we're going to give him 18 units sub-Q of Lantus long-acting with insulin, okay?
Okay. Do you mind if I ask you some questions
No,
before
go
we
ahead, please.
go further? So why specifically is the client receiving this medication? What action does the medication have on the body?
He is receiving it because his blood glucose was 290,
Okay.
so he needs some insulin, and it's going to lower his blood sugar.
Okay.
All right.
And when should you question administering this medication? Does the medication have a therapeutic serum level? What vital signs must be monitored? And what physiological parameters should be measured, should be monitored when the medication is being administered?
Right, we will question the result or the administration if his CBG is the normal limit. So anything's about 120 and below, you wouldn't need to give that necessarily unless the doctor would felt a need for it.
Okay.
All right. We're going to monitor his blood sugar. We're going to watch out for the main cause, which is hypoglycemia. And that's by, you can see, there's a lot of neuro alteration. So lethargy, confusion, seizure, coma. I mean, those are
Major ones.
telltale signs of that. Yeah.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in a hospital setting as well as a home?
Okay. We're going to teach him that he's definitely got to really clean the area prior to injection. Make sure that he's using the right size needles all the time, and make sure that he rotates injection sites in that area to avoid lipodystrophy.
Okay.
Okay.
And what are the side effects and potential adverse reactions?
If he has an allergy to it, anaphylaxis
Okay.
can occur, but I think because he's a diabetic for a while, it won't be an issue, but we'll still monitor it. But mainly, like I said, hypoglycemia is the main thing in case we bottom out of blood sugar.
Okay. And how will you know the medication is effective?
We're going to recheck the CBG within a couple of hours
Okay.
after giving, because the peak time is about 3 to 4 hours.
Okay.
So we'll want to check them.
All right. Awesome. Those are all my questions for now.
All right, well, let's go in and do the medication. Mr. Jarvis?
Yeah.
Hello. I'm Kevin, I'm your nurse, and this is Victoria. She's an SPC student. Do you mind if she comes in? Wash my hands here. All right. So we're going to give you 18 units of Lantus for your diabetes because your blood sugar was about 290, so we want to kind of treat that real quick.
Okay.
All right. How are you doing today?
I'm fine. Just working on some business work for my
Oh.
job.
Great. What do you do?
I'm an accountant.
Oh, okay. Sounds fun.
Yeah, it is. It's great fun. I love tax season.
All right, well, hopefully we can get you out of here soon so you can get back to the office. I'm sure you're going to be busy in the coming months.
I am. I'm
All
very
righty.
busy.
Yeah. What's your first and last name?
Ronald Jarvis,
When's your birthday?
6'10", 49.
All right. Any allergies?
No.
Okay.
Can I get a private room?
I will certainly ask the charge nurse and see what we can do with that.
Okay, thanks. And I want a window.
Okay.
And I want the therapy dog in here.
Okay.
Really?
I will call the volunteer service office and see if he's in today.
Okay.
Right? And if he is, we'll get him to come up to make an appearance. All right?
I really like pet dogs.
Okay.
It makes me happy.
All right. Well, I mean, that's not a problem. All right. Let me scan your band here. All right. What's your first and last name again?
Ronald Jarvis,
And when's your birthday?
6'10", 49.
All right. And any allergies?
Nope.
All right. All right. One more time. Okay. All right. So we're gonna come over here. We're gonna check the right med.
Okay.
Check the expiration date.
Mm-hmm.
Make sure it's still good. All right. It appears to be right. Everything's in order. Okay. So we're going to clean off the area here. Make sure that the top of the vial is clean and sterile. All right. We're going to pull up the amount of insulin to be given in the air. Okay. So we're going to go 18 units. I'm going to take the cap off.
Alert and oriented.
All right, and we're going to redraw it up there.
Posture is upright, gait is steady. Patient has qualitative deficits and his ability to identify sensation.
All right, so we got to 18 there. All right.
Wound care nurse, console has been ordered.
All right. You want to always use one hand to recap there. All right.
Mm-hmm.
All right. All right. Mr. Jarvis, is there anywhere that you would like to have the insulin injection?
I'm getting it in my abdomen.
Okay, on which side?
Right.
Okay. Well, then we're going to rotate over to the left so that side doesn't get swollen or overused, okay?
Okay.
All right. All right. So we're going to take our wipe, go about 1 to 2 inches away from the belly button, clean it off in a circular motion. All right. We're going to pinch the skin there, going at about 45. Administer the medication. Never recap, just put it straight in the sharps there. How you feeling, Mr. Jarvis?
Fine.
All right. Any questions?
What are some symptoms I should be looking for?
You want to monitor the hypoglycemia. So if you feel drowsy, lethargic, just anything that's not normal with your medication, just let us know, okay?
Okay.
All right. I know that you have a tray coming soon, okay, for dinner. All right. And I know that you wanted to know about diabetic diet teaching. So we want to make sure that you stay around 2 grams of sodium daily,
Okay.
and that about 60% of your total intake should be carbs, okay?
Okay.
And here's some information about it, okay?
Thanks. I'll read this.
And I will come back in once you're done eating, and we'll discuss any questions you have with this, okay?
Okay, thanks.
All right. Is there anything else that I can get you?
No.
Okay.
Just the dog.
All right. I put your call light within
Thank you.
reach, and if you need anything, just let us know, okay?
Thanks.
All right.
What are the side effects and potential adverse reactions?
All righty. We'll get this taken care of here, okay? And I will follow up with your information about the dog, okay?
Okay, thanks.
You're welcome.
I like really big dogs, not those little yappy ones.
All right. There is a nice little dog that comes by, and he's a black Labradoodle.
I love Labradoodles. Those are my favorite.
A lot of people love Labradoodles, so we'll get that taken care of, okay?
So soft and fluffy.
And we'll follow up on the
And I'm just here with your,
on the window, okay?
Okay.
All
Bye, Victoria.
Bye.
Come back and see me.
All right. If you have any questions, like I said, just hit your call bell, okay?
Okay, thanks.
All right.
So I do have some more questions
Okay.
for you when you get a chance.
Yep. What's up?
All right. So, were there any pertinent pieces of information you reviewed before administering the client the medication?
Check the CBG to make sure that it was at a point that needed insulin, and it was. It was 290. So.
Alright, and did this information affect your decision to administer the medication?
It did. The CBG was way too high, so we had to do something, and that was giving insulin.
Okay, and did this information affect how you administered the medication?
No.
Alright,
Nope.
that's all my questions. I appreciate your time.
No problem. Come back anytime. Thank you.
Mm-hmm.